All right, today we're going to break down a technology that has been a total game changer for expecting parents, non-invasive prenatal testing, or as you'll hear it called, NIPT. So let's think about this for a second. For the longest time, expecting parents had this really tough choice to make. How can you find out about your baby's health, the really important genetic stuff, without putting the pregnancy at any kind of risk?
Yeah, on one hand, you had these invasive tests, right? Like amniocentesis. Super definitive, but they came with a small but, very real risk of miscarriage. Then on the other hand, you had safer screening options, but they just weren't as accurate. It was this constant balancing act, information versus safety. But then a whole new approach came along and just flipped the script.
And that new approach, that's NIPT. We're talking about a way to get early, incredibly accurate insights into a baby's genetic health, and it works in a totally different way. So here's the magic, the core idea behind it. While you're pregnant, the placenta, which by the way has the same genetic blueprint as the baby, is constantly shedding these tiny little fragments of DNA. And where do they go? Right into the mother's bloodstream. NIPT is all about analyzing that DNA to screen for genetic conditions. The best part, you don't have to go anywhere near the baby to do it. It's brilliant.
Now, a breakthrough like this doesn't just happen overnight. It was literally built on decades of research. It all kicked off in the 90s when scientists first discovered, wait a minute, there's fetal DNA floating around in the mother's blood? That was the aha moment. But it still took nearly 20 years to go from that discovery to the reliable test that we have today.
Okay, so how does all that cool science actually turn into a test you can take? Well, the process is way more straightforward than you might think, and it really just kicks off with a simple blood draw. Look at this. It's so simple. Step 1 is just a regular blood draw, nothing special at all. Then that sample goes off to the lab, and that's where the high-tech stuff happens. They isolate those tiny DNA fragments we talked about, analyze them, and then boom, you get a risk report back in about a week or two. That's it.
And because the process is so simple and non-invasive, it leads to some huge advantages. This is why we call it a game changer. It's all about giving expecting parents that peace of mind.
First off, the accuracy is just wow. We're talking over 99% detection for Down syndrome, which is the most common condition it screens for, and it has really low false positive rates. For a test that's non-invasive, that level of accuracy is absolutely remarkable. And then there's the timing. You can get this test done as early as 10 weeks. That is a huge deal. It gives parents so much more time to take in the information, to plan, and to figure out any next steps without feeling rushed. And maybe the most important point of all, it's completely safe, zero risk of miscarriage. Remember that trade-off we talked about at the beginning, information versus safety? NIPT just erases it. It takes that impossible choice right off the table. Okay, so it's accurate, it's early, it's safe. It sounds perfect, right? Well, like with any technology, it's really important we're clear about its limitations. Knowing what NIPT can't do is just as crucial as knowing what it can. And this right here, this is probably the single most important thing to understand. NIPT is a screening test, not a diagnostic test. Think of it like a weather forecast. It tells you there's a high or low chance of rain, right? It doesn't say it is raining right now. It assesses risk. It doesn't give a definitive yes or no answer. So what does that mean for you? It means if a result comes back as high risk, that's not the end of the story. The next step is always to confirm it with a diagnostic test, like an amnio. NIPT is like an incredible guide that points you in the right direction, but it's not the final destination. And you might be wondering, why isn't it 100% diagnostic? Well, one reason is this really interesting but rare biological thing called placental mosaicism. Remember, NIP is testing DNA from the placenta, not the baby directly. And in some very rare cases, the placenta's DNA can actually be different from the baby's. So that mismatch can cause a false positive or a false negative. All right, so as this technology has gotten better and better over the years, it's also expanded. Now there are different versions of the test, offering deeper insights and more advanced options for parents. And you can see the difference pretty clearly here. Your standard NIPT looks for the most common conditions, like Down syndrome, Trisomy 18 and 13. But then you have something like NIPT+, which casts a much wider net. It's looking for rarer conditions, these tiny missing bits of chromosomes called microdeletions, and even some single gene disorders. So you're getting a lot more information, all from that same simple, safe blood draw.
Okay, let's tackle a question we get all the time, especially from people who've gone through IVF. What if you've already had your embryo tested with PGT-A and it came back normal? Do you still need to do NIPT?
And the short answer is yes, it's still highly recommended. Here's why. No test is perfect. And because of those tricky biological things like the mosaicism we just talked about, doing NIPT once you're pregnant gives you this extra layer of reassurance. It's a completely risk-free double check to make sure everything's still on track. Okay, we've covered a lot of ground, so let's boil it all down. What are the key things you need to walk away with? Let's call this your NIPT action plan.
All right, here's your checklist. First, it's available to pretty much everyone, usually starting at 10 weeks. Second, and this is the big one, remember it's a screening test, not a diagnostic one. A high-risk result always needs to be confirmed. If you're using a surrogate, make sure you bring it up with their OBGYN, and it's worth thinking about NIPT Plus if you want more comprehensive info. But the bottom line, talk to your doctor. They'll help you figure out if it's the right choice for you.
And really, when you get down to it, that's the whole point, isn't it? In a situation that can be filled with anxiety and unknowns, isn't more risk-free information just better? NIPT is a powerful tool that helps turn that anxiety into informed action, giving you more clarity and more confidence on this incredible journey.